Good evening and welcome to Doctors on Call. I'm Dr. Mary Owen, Associate Dean of Native American Health and Director of the Center for American Indian and Minority Health at the University of Minnesota Medical School. I'm also a family physician for the Fond du Lac Band. And I'm your host for our program tonight on Indigenous health. The success of this program is very dependent on you, the viewer, so please call in your questions tonight or send them in ahead of time to our email address at ask@pbsnorth.org. The telephone numbers can be found at the bottom of your screen. Our panelists this evening include Dr. Ryan Dunkley, a family medicine physician for the Fond du Lac Band, Dr. Charity Reynolds, Medical Director for the Fond du Lac Human Services Division, and Ricky Defoe, Elder and Pipe Carrier in Ojibwe Country. Our medical students answering the phones tonight are Roan Anderson from Fort Worth, Texas, Nicole Fall from Pine Island, Minnesota, and Lila Lowmiller from Dent, Minnesota. And now on to tonight's program, Indigenous Health. Before we begin this evening, I think it's really important to make a couple of points. One is that many people don't understand, or people have this false assumption that Native health care is free. In fact, it's not free. When the United States government negotiated treaties with Native American nations and Native people, they promised in exchange for land, for millions and millions of acres of land, they promised health care indefinitely. So the form of our health care comes, or this form of what they offer us, the government offers us, is the Indian Health Service. And that's a government, mostly a government-run program. However, many tribes, about 60% of our tribes since 1975 have been running their own programs, are starting to run their own programs since 1975. So Fond du Lac community, our Fond du Lac Health Center, for instance, is run by the Fond du Lac Nation. And we have two clinicians tonight from Fond du Lac who work at Fond du Lac Clinic and one traditional elder. So as we go on to, I think it's important that we start out just with, tell us a little bit, Dr. Reynolds, how is Fond du Lac, how is Native health different than non-Native health?
That's a great question. The Native health is for the community, so that's really important to know. So, as you mentioned, Fond du Lac is run by the band. So the Reservation Business Committee, those are elected members from the community, and they are the ones that make the ultimate decision of how our health is run. And they really want the best for the community. So they do really well in hiring the best that there is. We have, Dr. Dunkley, and we have Ricky Defoe, and we have yourself, Dr. Owen, who is part of our team. They really work really hard to have people. We have nurses, we have medical assistants, we have family nurse practitioners, we have certified nurse midwives, we have lab technicians, we have x-ray technicians. We have everything that we can possibly have that are, selected from members of the community, and it's especially for the community. And we look for very specific things, make sure they're passionate about the health of the community. It's really cohesive, and we respond really well to the community. So it's not someone else telling us what to do, it's the community itself telling us, I really see a need for this, and so we work towards that. Okay, we want to meet you, we want to meet that need for you, and so we'll work together, we'll collaborate, and be able to meet that need for people. It might take us a little bit because sometimes, processes take a little long, but it's for the community is the biggest thing.
Dr. Dunkley, anything to add to that? How is our healthcare different, or what do you see? You were a resident in private care, in private systems, and now you work for Fond du Lac. So what are the differences that you see?
I think that I would agree that one of the main differences that I see, at least from my experience in residency in just a regular hospital system as compared to with Fond du Lac working there, is that it is really mission driven, and a lot of the people who we have working are from the community, and so that instills a level of investment, I think, in the work that we do, that in general people who go into healthcare, they care about helping people, but I think that there's another level of that in our healthcare system with the people that we have working there.
Mr. Defoe, one of our traditional elders, do you see any differences? You've probably experienced healthcare in both private and in our own healthcare setting. Do you see any differences?
Can you clarify that a little bit more between the traditional way of seeing healthcare versus the
healthcare that's offered through a non-IHS or a non-tribal clinic versus our tribal healthcare? like when you go to Essentia versus our own clinics?
Well, a couple things come to my mind when I view those two, particularly for Indigenous on reservations, the clinics. Two things: attachment. So we belong to a community, language, culture. The space is there. The medicines are used. The familiar faces and things are there. The role models are there. And also being authentic to our spirit, the spirit of community, the spirit of love and compassion, and having empathy, a part of that community. The respect is there. So I think it really enhances health in the community. The old way of seeing the healthcare systems, the access, there was quite many challenges there, access to that, discriminatory practices and racism and things. There's a long history of that, and that shows in the disparities in health outcomes. So we welcome traditional ways into healthcare now.
Can you tell us more about what those traditional ways are? When people hear traditional medicine, they think a lot of different things. How do you define it?
Well, I think for Indigenous peoples, I think we have to contextualize that first. And first is the society that we've been born into in 2024. Indigenous peoples have been born into a society that's a society in American culture that has an ethos of violence and death. The characteristic spirit of that, the history is there. Gun culture is xenophobic, highly sexualized, a very oppressive society, in which really sociopathic behaviors are manifested in that society. We've been born into that. So for Indigenous peoples to, the concept of health and wellness in that society encompasses multiple dimensions, particularly spiritual, physical, mental, emotional, social, cultural, and environmental, to name a few. But the right to health is a component of human rights law. So for Indigenous peoples, the right to health is interrelated to, the United Nations Declaration of the Rights of Indigenous Peoples, which is an international document, and also more nationally here with the United States, the treaties, which supposedly ensure health care and education. Our elders have adamantly said that we're not to conflate or equate Indigenous peoples to non-Indigenous peoples. Any entity, or even including minorities, vulnerable groups, or local communities. So we have to, we see the world in that way, as distinct peoples, cultures, and ways, because of the health outcomes that have in the history of healthcare in this culture that we have been born into.
Thank you. Given that, and given where you work now, and I happen to know where you trained, all of that put together, why do you work in Native Health now, Dr. Dunkley?
I think that Native Health was always something that, you know, I hoped to work in, or at least thought strongly about working in, and that starts with where I'm from. My dad is a member of the Mille Lacs Band of Ojibwe here in Minnesota, and so I'm not a member myself, but it's certainly a community that I grew up around. And also that community helped with funding some of my education, like while I was in college. And so I always hoped to be able to go back and give back. And so that was something that, you know, carried through my education. When I applied to medical school, I picked the University of Minnesota Duluth campus, in part because the Center for American Indian and Minority Health, which you know well about, is there, and was really happy to have that be part of my medical education. And then when I picked a residency program, I also looked for a place that I knew that I would at least get close work with tribal communities, which I did in rural Oregon where I was. And And so then it was just a natural fit when looking for a job to look for a place where I could serve a tribal community here in Minnesota when I came back, and you helped me find a good place, and happy to be here. So, yeah.
Dr. Reynolds, why do you work in Fond du Lac, or do you want to add to that?
Well, I would say we're happy to have Dr. Dunkley on our team. I grew up in rural Arizona, so I always wanted to work in a community that served rural communities because of the health disparities, like Ricky mentioned, all the, issues with, historical trauma and social drivers of health, social determinants of health, and that influence. And growing up in rural Arizona, I come from a Latino community, and I wanted to make an impact. And what drew me to, in Arizona, there's a lot of different Native communities as well. So, just being drawn to making change and wanting to help and be an advocate is one of the reasons why I wanted to do that. And came to Minnesota because my husband is originally from Minnesota, so that's how an Arizona person ended up in Minnesota. But we love winter. We named our daughter Winter, and so that's okay. And we love the community. I've learned so much from working in Fond du Lac, and I bring a little piece, but I feel like I've just learned from Ricky, from Dr. Vineal, from everyone around me so much more, and being able to advocate for the community because I have the voice and I have that position to be able to say, these are the changes that we need. This is what our community wants, and then hopefully someday I can pass that torch over to, one of your physicians that you're training to be able to say, okay, it is your turn to continue. We really need Indigenous physicians. It's for the wave of the future, and I'm, yeah.
Maybe Dr. Dunkley. Mr. Defoe, you are in offering traditional medicine now at the Fond du Lac Clinic, and we are, that's such a privilege, I think, that we have a clinic that we're able to offer that at. Are you seeing a lot of people come in the door for traditional medicine? Are you seeing more? Is there a trend one way or another?
Well, I think it's the numbers are definitely going up. I think the awareness is there. The acceptance of there, I think, the greater acceptance will depend upon being offered, and then as the success, as the healing comes through involvement with the community members and relationships and things like that, as we see that wellness come about, the hope is that things will take off from there, and I think the numbers are showing that. Again, there's different dimensions of healing that's taking place. The process is taking place to bring about some sort of back to being balance. Healing is a restoration to some sort of normal mental and physical health, and so the healing is taking place. We think about because of the society that we live in, there's lots of lateral violence that takes place, and it's become a huge social problem in Indigenous country. So we recognize that, and we just want to offer to be there for the ones that are willing to join us in the healing journey. So I think the challenges are many there, and we're up for the challenge. If we don't do it, if we don't reclaim, revitalize traditional healing ways, if we don't practice these ways of life, then our children will see that there'll be some more additional despair in a very toxic culture called American culture, which is globally now. So those are challenges that we face, and I think we have the ways and the means to bring healing and in medicine. I want to say that people say that doctors and things, because the definition to doctor, I think, is a practitioner, a qualified practitioner of medicine. And so one that practices medicine. Medicine's a huge huge field, and it comes in the different practices and procedures that go about that. So we want to be part of the prevention, the treatment, and the relief from any of those symptoms that come about in a society, whether it's physical or mental, emotional, or what have you. So we have a lot of work ahead of us, and I think that given a chance, and we have been, we're up for it.
And I think you were referring to something really important. People often think it's just anecdotal when we say that our culture is protective or that there's power in our culture to help improve health. But we know from good research done from Indigenous researchers like Dr. Melissa Walls that in fact you can show that people who are more involved in culture tend to have better health outcomes. So thanks for pointing both of those out. How can doctors, speaking of traditional medicine, Dr. Dunkley, how do you ask your patients, or what do you recommend to non-Native, in particular, doctors about asking their Native patients about their cultural beliefs? How would they approach that?
I think that, at least in my own practice, it's just something that you should ask about as you would ask any patient about their beliefs and what's important to them in life. Is from a primary care perspective, that's a critical part of being able to provide someone adequate care, and good care is knowing what they value. And so if I were meeting a patient for the first time, then I'm going to ask them about what's important to them, be that cultural, religious, or what have you. And so with Native patients, just like any other patient, I think that it's important to ask what cultural traditions are important to them. And when I establish care with a patient, I always make a point of doing that. And you know, some Native patients are very involved with Native culture. Some are less so. Some are trying to get more into it. There's obviously a long history of having culture, banned and stolen from Native communities, and so that plays a role. But yeah, I guess on the most basic level, you just ask the questions. Otherwise, you'll never know the answers.
And I appreciated your comment about how people are changing, right? So one day they might not be into the culture, and then later on in life, as they go to one of Ricky's classes, they may be more involved in their culture. So you have to keep asking those questions.
Yeah.
Good. Dr. Reynolds, looks like you wanted to add something to that.
No,
Okay.
I did not.
Okay. So let me ask you a question, Dr. Reynolds.
Sounds good.
If you were to implement one plan or had one goal, how would you try to improve Indigenous health? Just one.
Just one. So just one, and this has been on my mind, and actually it's in one of my goals for next year, and working with Ricky about this. More traditional health in the westernized medicine. So we are trained in Western medicine, and it's not the answer. There's some things that it's good for, but it's not the answer. And I think, research is showing that. There's neurobiologists who are learning, how important music is and how that is healing. And, Ricky knows this from before time, and it's passed down how important drum ceremonies are and how vital these are for health. So I want to see more tradition into the Western way we do things, and be able to connect people and be able to connect that culture. So there was that break, right, in racism and colonialism that caused Indigenous communities to lose that culture, and they did it for a purpose, right? So that people could be unhealthy, so people could die off and wanting to kill off the race, and they broke that. And the things we are seeing now on top, we're seeing cardiovascular disease, cancer, these things that we see on the outside is really because of history and what's happened and the trauma that's happened. And how do we connect that? How do we fix that? Is going back to traditional health, traditional medicine, that connection, like parenting styles, those were broken. The community was broken. Ricky has definitely hit on that point of how American society is broken, and not only for Indigenous communities. Indigenous communities have had to suffer for a really long time and have had to build resilience, but other communities are seeing how parenting right now is in a crisis of how much stress is going on and difficulties and screens and, you know, the influence is increasing anxiety and depression and things like that. So if I had to do one thing is bring more tradition into the Western way that we deal with health in Indigenous communities.
Either you want to add anything to that? Very well stated.
Yeah, I really
idea.
think that it was well stated. I think the acceptance of, by mainstream medicine to embrace traditional ways of seeing the world and of healing, I think that encompasses what community is all about, to have respect for one another and love and kindness for one another. And that goes a long ways in healing moments. Life is made up of those moments. So when we start to lift one another, the ways we practice healing and being in community, I think it's a win-win situation for everybody. Our elders have always said that we can complement one another because there's a concerted effort that came about for many, many generations, that our healers and our ones that practice a way of life were denigrated and actually incarcerated for ways of seeing the world and working. And that was a concerted effort not only by the American public, but also particularly by institutions such as the American Medical Association, which was formed in 1847, but I think about 1900, that's when they started to really push that denigrated Indigenous ways of healing. So now we fast forward to 2024, and there's an acceptance of healings from the American Medical Association that really goes to, for instance, the Medicaid Section 1115, which is a waiver to have discretion on Indigenous tribes to bring about healing practices, programs on their homelands. So it's been a long time coming. We know the history of discrimination and racism in that. The American Medical Association, I'm not talking disparagingly of them, but I want to bring out the facts that they did, in fact, apologize publicly to the African American culture about the racism practices and things of discrepancies. There's now a push to include a sort of affirmative action, even to bring about Indigenous people of color into the medical profession. So things are changing slowly. We'll see what the future holds. We have hope and promise.
Well, the concerns I have, though, is just like we know that there are low numbers of Native students going into medical school. We only graduate maybe 20 to 40 Native medical students out of 20,000 physicians every year, 20 to 40 Native physicians. And we see the same shortage in traditional medicine. I was just we were just commenting on how often I call on you to help us with teaching our students things or working in the community and supporting our traditional ways. But we can't keep doing that. So we need more young people to study traditional medicine as well as Western medicine. Would you agree, or?
Yes, I agree wholeheartedly. I think that the Indigenous people have a huge problem, not in the community, but the living in the society that we live in. Again, a concerted effort. We say generationally that it was a genocide taking place. So when we think in those terms, we think of the urgency. So the Indigenous peoples probably make up, there's a couple different numbers, 476 million people on the global, and others said 370 million, but represent about 6% of the population. And we like to think that of that Indigenous peoples on this globe, that they control 22% of the land base. But of that 22% of the land base is 80% of the biodiversity on the globe. So modernity and the modern world, so civilized world, so to speak, represents, that's why I said the ethos is violence and death in that civilization. So that's them are the facts. Those are the truth in the 2024 and metadata and things. The truth is buried beneath all that data, and we just got to expose it and share it with our people. And then our people will begin to heal, and then the truth. So our intergenerational knowledges are coming out. They become our experience in this society we live in, and it becomes our truth, our individual truth, our family truth, and our community truth. So.
Thank you, Ricky. I think this conversation tonight has gone faster than any of them because it's been so fascinating and such a great conversation. So thank you all for being here. I want to thank our panelists, Dr. Ryan Dunkley, Dr. Charity Reynolds, and Ricky Defoe, and our medical student volunteers, Roan Anderson, Nicole Fall, and Lila Lowe-Miller. Please join me again next week for a program on lung problems, influenza, pneumonia, and emphysema, when my panelists will be Dr. Andrew Thompson and Dr. Jason Wall. Thank you for watching, and good night.